Hello and welcome to the Medical Receptionist Network podcast show. My name is Siobhan Atkins and I am your host for today. I wanted to make sure we got a show in on today because today is a big day for healthcare and health insurance. It is the last day to enroll in a health plan through the marketplace via healthcare.gov, and many patients will be changing over their insurance, as well as possibly you yourself, whether it's through your employer or if you have insurance, privately. This is the time to renew. And today is the last day for many people to do that. So it's a big day. It's going to be a day that will affect, how your office moves forward, how your patients are making, different decisions regarding their health plans. And that may result in many new patients for your facility. That may result in a decrease in patients who can now, attend your facility. There may be various increases in deductibles and co-insurances and co-pays, as well as the requirements. So, if patients need anything as far as, referrals and prior authorizations and things like that, that may change, whether it's more or less or, staying the same. But that definitely always affects healthcare facilities in the earlier part of the year and really throughout the year, because as people are coming in that haven't been seen, you have to get their new information and reassess their benefits. So today is going to be an unedited show. I've had the opportunity to work with Lance Smith, who's been doing our editing and adding our wonderful intro. He goes by 10x Millennial on Instagram, but I met him a couple years ago and he's been assisting with that. But I really wanted to get this show out today, so we're gonna skip that and return to it at the during our next show. So aside from the updates in healthcare for 2018, going into 2019. Wow, we're going into 2019. That's amazing. So it's been an interesting year, and I hope definitely for myself, and I hope many of you have had some great milestones in your life and within your career, and have had some good experiences. What I wanted to talk about today were certain different kinds of patients and what you can do as a medical receptionist, to better serve these patients, maybe some suggestions and on what to do and what not to do with certain kinds of patients. I had about 12 to 13 written down, but we're going to probably focus on about 7 of them today. So first, we are going to talk about the angry patient, right? Sometimes people come in and they are not happy. Now, sometimes it directly has to do with something that went on within your office, or it is just, something else going on in their life where, they're just passing on that kind of negative energy. But one of the things that I always recommend when you're dealing with someone who's angry, especially face to face, is not to become visibly irritated. For one, you have to keep yourself separate and understand that it's not a personal attack on you, and you have to take yourself out of it, because in your personal life, if you get upset or someone's being rude or mean or angry with you, sometimes you feel that blood rushing up to your head. You get really you're ready to defend yourself. But that's not what we need to do in our offices. You can always support your office and other ways, and always, support your coworkers and not, put them down or agree with negative comments of patients. But when I'm talking about your one-on-one interactions with the patient, try not to become, visibly irritated. I'm not saying to laugh in their face. Obviously, that is the wrong thing to do. But you want to kind of keep a neutral tone in your voice, a neutral, facial expressions, kind of keep yourself kind of soft so that you are able to listen, because your job is to be an agent to find a solution. You are going to be the person to, whether you have to transfer this information to someone else or take notes or, actually resolve it yourself, you need to have a clear mind. And on the other side of that is, if an angry patient becomes angrier, you may have to make some quick decisions to whether it's to protect yourself, protect your office, or, have someone removed. You have to have a clear mind to take the next steps for that to happen safely. So you always want to, keep yourself neutral and not become visibly irritated, because then that shows them that you're looking kind of for a battle back and forth. And that's not what you want to do. You want to resolve the issue and get to the bottom of it. So also always redirect to get to the root of the issue, because sometimes when people are upset, they're going to, go from one topic to another, but you need to redirect and say, you know what, I understand what's going on. I understand all of your concerns, but let's look at issue number 1 first, and let's see how I can help you with that. And just start chipping away and, trying to resolve things in the best manner that you can. Because you cannot, you let someone go on and on and on. You haven't come to a solution. You're kind of nodding your head, and you have no answers for them because they're hitting you with so many different things at one time. It's your job to kind of take control of that and say, you know what, I understand, you thought your appointment was today. It's actually tomorrow. Let me see what I can do about that. And then, go through whatever processes you have within your office. Another kind of patient, it would be the chatty patient. Someone who definitely likes to talk beyond the purpose of their call, beyond the purpose of their visit with you. So you're at your desk, you're trying to do your work. They come in, and they get registered, they get set up, and they're still kind of talking to you maybe about their children or about the drive-in because there was snow on the ground, or they've been so tired because they've been working so much. So at some point you should definitely make eye contact, acknowledge that you're listening to them, but also find a way to interject and just let them know, hey, you know what, I'm sorry to interrupt. I just wanted to let you know you're all ready for the doctor. I'm just going to ask you to go ahead, have a seat, relax, and someone will be with you, as soon as they can. Only because if you continue to engage, for one, they're going to kind of do that every time, whether it's you or anyone else. And, you want to let them know that you're busy, not in a way to where it's like, I don't have time for you, but hey, you know what? I have other patient requests I have to take care of. They have to be done by the end of today, but you're all set. I've taken care of you. Your chart is up. Go have a seat. And if you have any questions, we'll see you on the way out, and just kind of shut it down in a way, in a positive way. If you have someone over the phone, you're going to want to first of all, if it's a patient that you're familiar with, you generally know, as soon as they call, the route that the conversation may take. So the first thing you want to do is get the information that you need to take a message, make an appointment, mail them something, whatever it is, just keep making sure. Okay, so I want to confirm that you need me to mail this letter to this address, from this doctor stating X, Y, and Z. Is that correct? They say yes. Okay, fine. You're making your note. They're still talking. That's fine. Once you've completed that request, then you can say, hey, you know what, Ms. Smith, it was really great talking to you. I've submitted that message, and I'm going to, let's see, what did I have here? I think, I don't want to say I'm going to let you go, because that's I think that's a little too dismissive. But, you want to say, I've completed your request. You're all set. It was great talking to you. Have a wonderful day, or something to end it, to kind of let them know, we're done. I've done what you needed me to do. And, you'll get used to doing that, or easier, depending on what the situation is. And obviously there's going to be a level of sensitivity there if the patient is talking about something more serious, and, always want to send them well wishes and things like that. You don't want to be dismissive. You always want to have that empathy and caring, but at the same time, you can't sit on the phone with a patient for 10 minutes for a 60-second request, because that's going to affect the overall efficacy of your job and what you're doing. And, there may be other patients waiting who require, assistance as well. So definitely, with the chatty patient, you have to get the information you need, do what you need to do as quickly as possible, and, find a way to cut it short. When you have your moment to interject, just say, you know what, great talking to you. It was nice to hear from you. I'm glad you're doing well. Or, I hope your son does great in his game, and we'll love to hear about it, when you come in. Or, just you have to make sure you're pushing it along. Just don't be a sponge at that point, because you are at work and you do have other patients to tend to and other responsibilities that you have to meet. So next we have the impatient patient. So some patients come in and, I think the general expected wait time, maybe 15 minutes, most places, right? So you come in, you have a seat, you wait your 15 minutes. Next thing you know, you see a lot of other people going in and out. Granted, they don't know what other providers are back there. They don't know if these people are just going to the lab or just to be, have their history taken or what have you. And they're seeing all this go on. And then, now we're at 20 minutes, 25 minutes, and no one has given them any update. So a person who is already impatient is going to come to the desk. They're going to address this with you. So you always want to be on top of that, kind of, just your general waiting room ethics, basically, and letting people know, if you know about a wait, let them know as soon as they come in. Apologize for the delay, make sure, they don't need anything, that kind of thing. Walk out into the waiting room when you can. And, if it's a general announcement that affects most of the people in the waiting room, that's fine to do as well. One thing that and also acknowledge that, you understand their time is valuable, especially when someone has come up to you and, complained. And whether, it doesn't matter if they have an attitude or not. It's your job to make sure that the patient is taken care of in the best way that you can, within your power and your position. So, Ms. Johnson, I understand, your time is just as valuable. We are just, we have a delay for whatever reason. The doctor will definitely spend just as much time with you as he has, with his other patients. But I'm just going to ask you to give us a few more moments. Please have a seat. If you need anything while you're waiting, let me know. The other thing that I've witnessed in some offices, so maybe a medical assistant comes out, or a nurse, they come out to take one patient in, right? So they're opening the door to the waiting room. So if you're really busy up front, why not ask that person to make the general announcement? It's not taking time away from what they're doing. They're waiting for Bob to walk up to the door, and they can say, hey guys, thank you so much for your patience. We will definitely be with you as soon as we can. And they're closing the door and they're going back. So if someone does have a question, they will come up to you, but at least there's someone acknowledging that there is an extended wait time, and that they're aware of it. And it's someone clinical, not at the front desk. So it's kind of a different department acknowledging the concern of the people who, may be waiting, or the person who is extremely, impatient. It's just a different layer of, it's just a different way to address it. Now, that doesn't mean that's not your job to continue to monitor the flow. But if you can have other staff there, it's not them doing your job. That's just them assisting, with notifying the patients of what's happening in your office. So I think that that's sometimes helpful. Or, if it's only one or two patients in the waiting room, they'll take in the next person, and then they'll acknowledge the other person directly and say, we'll be with you as soon as we can. And, they may even have more information than you at that point, because they are working the back and they're, taking patients in, and they know about how long, for a room to be open, etc. So now we have the sick patient. Now, granted, we work in healthcare. A lot of people are sick, right? But I mean sick as in, I'm coming in with the flu, I'm actively vomiting, perhaps I have a chronic illness that just affects me daily, and it's visible that I'm, in pain or very ill on this particular day. So a lot of times they may not be in the best mood. Always, again, check in with them, make sure they don't need anything. I mean, simple things like a glass of water. All offices don't have tea and coffee, in the waiting area, but maybe, that could be of use to them. If someone is visibly coughing and sneezing, and offer them a mask. If you have empty rooms, if it's your protocol to offer people, which hopefully, if you're a large enough office and you have the space, it's always great to separate someone who may contaminate the entire waiting room. Offer them to wait in a different space. It's not going to speed up their appointment, but it's going to give them a little privacy and keep the germs kind of contained. Also, make sure you have hand sanitizer, or let people know where the bathrooms are. And once that person or those people leave, especially if they're have flu-like symptoms, things like that, take a Lysol wipe and wipe down the waiting area, because the rooms are being cleaned after each patient, but the waiting room generally is not. And a lot of times it doesn't take much to kind of spread germs that way. So definitely be on top of that, and just show concern for these people, because that they are a priority perhaps on that specific day because of the issue that they're experiencing. And so that brings me to showing a sense of urgency. So showing a sense of urgency, if someone comes in your office and they're visibly ill, you need to attend to them, because if I'm in, or you have someone else in for a hangnail, and somebody else is in for a ringing in the ear, the person who has a fever and is vomiting is going to be a priority. So show that sense of urgency. Make sure you let your clinical staff know that they're there, and they don't look well, or whatever the case may be. Whatever the protocol is for your office, follow that. And sometimes maybe you guys weren't expecting it, so it's kind of a surprise. Oh, someone, especially if you're in urgent care and family medicine, people may not have an appointment, they're coming in and they're this sick. Make sure you're letting your clinical staff know, and just having that circle of communication so that that person can be taken care of, because it's not every day that you're going to be in that state and have to seek medical attention outside of the emergency room. Next, we have our elderly patients. One of my things that I really, excuse me, learned, you just you can't rush people. You shouldn't rush people in general. When you're dealing with an elderly patient, just because they're moving slow does not mean that their mind is not with what they need to be doing. So if they're taking a lot of time to fill out paperwork, it's just going to take them that much time to fill out the paperwork, and you have to kind of be sensitive to that. And you can offer help. Maybe they have a problem, seeing something. Maybe their hand is shaky, and this is not only elderly patients, this is with many patients, but especially with your elderly patients, you want to, be mindful of that and pay attention, to that, and just don't rush them. Have patience with them, and just be as accommodating as you can in that instance. And hopefully your office has certain things in place that will, especially if you're in geriatric medicine, to help speed things along, help make things a little easier for your elderly population. Another thing is to listen to them. Don't put words in their mouth. Sometimes people talk really slow, and you are just trying to do your job, and they're trying to get something out, and you're kind of trying to figure out what they're getting at, and you just start saying things and assuming, that's not a good practice in healthcare, because what someone may be trying to say is not what you're thinking. So, always try to listen to them. And if you do make a suggestion of something, maybe they're not spitting out, or they're, it's just not coming to mind, say it, but then say, is that what you meant? Or, confirm it with them and get a yes back, to make sure that you are on the same page. And that can, and that applies, I think, with many patients as well. Just make sure, you're not just assuming what someone wants over the phone or in person, and if you know the answer, or exactly what they're referring to, and you say it out loud, get that confirmation. Say, is this what you meant? Do you need X, Y, and Z? And let them answer you back. So you have to have the patience, and you have to listen to them. All right. We're at number 6, I believe. So we have the nervous patient, right? Some patients are very nervous. It may just be because they're going to a healthcare facility. It may also be because they are expecting certain results, or maybe they're coming in for a procedure or something of that nature that would heighten their nerves and, their anxiety at that time. So, if they come in and they're expressing that to you, just let them know that you understand that they're very nervous. Let them know that your clinical staff is going to take care of them and explain everything to them, and also, just also have them sit in the waiting room, to relax until they're called in, and just show that compassion. Understand, don't dismiss them, because that doesn't help. If you're already nervous and then someone at the front desk is dismissive, that does not help them going into now the patient room to experience whatever they need to go through next. If you have someone who's on the phone and maybe they're nervous, or they're, if you have to take a message, maybe they're waiting for a nurse to call back. Again, just be very reassuring, compassionate on the phone with them, and just let them know, we'll absolutely get back to you, get the answers that you need. Right now, while you wait, please, put yourself at ease, and so will call you back before the end of the day, and I will let them know that, this is you let them know, hey, I'll let our nurse know that you're really nervous or you're really anxious about this. Hopefully they'll be able to get back to you a little sooner than usual, so we can ease your mind. You just have to say certain things within what your office can do. Don't promise someone something when you know that the doctor's not in for 2 days. Don't do that. But even if there is someone who's nervous and they need to speak specifically to a doctor and they're calling time and time again, then that's up to your nurse manager or your nurses to deal with that, because sometimes they can call and maybe they're not going to give the answer, but maybe they're better at intervening and easing the patient's nerves and calming them down a little bit until they can get the answer from the physician, because sometimes you just can't give people what they want right now all the time. But whatever we can do as a healthcare community to help our patients is what we need to do. And sometimes we have to take those extra steps in making those extra calls, and taking the calls, and spending that extra minute with our patients. Okay, the last one that I'm going to talk about today is patients with an accent. I cannot tell you how many times I would receive calls that were transferred to me because someone would say, I don't understand what they're saying. I pick up the phone, the person is clearly speaking English. Granted, they may have a very strong accent, which is fine. So what does that mean? That means you have to listen a little closely. That means you may have to ask this person to repeat themselves, or say, hey, you know what? I didn't understand that. Can you repeat it? Or if you thought you understood it, repeat it back to them and say, is this the information that you'd like me to, pass on? Or is this what you're requesting today? Is this the day that you're looking to have an appointment? Is this the doctor you want to see? But don't just, as soon as you hear a voice that doesn't sound like yours, be dismissive of that and intolerant of that, because that is, any office is welcome to any patient from anywhere. And sometimes it is very off-putting when someone just immediately has no patience for you because they cannot understand you as easily, not as clearly, but as easily as they may understand other patients. So your tolerance and your professionalism really are important at this point, when you're dealing with that. And some people, I've seen countless people be very frustrated by this, and it kind of makes me sad because it's like a little intolerance. And we're treating everyone. I don't care what you're working, whether you're in primary care, pediatrics, obstetrics, orthopedics. All people need care. So everyone is not going to sound like me. Everyone's not going to sound like you. Everyone may not have speak perfect English, but they are speaking English. So you have to, just maybe put on your thinking cap, block out everything that's going on around you, listen to them, and you will be able to, take care of that patient. And that's really important. everyone has to be included and feel as a part of your practice if you want to continue, to welcome new patients and patients from other cultures, other countries, and who speak different languages. So that's all I have for today. I would love to hear your feedback on how you are able to handle certain patient situations with different types of patients and different scenarios in your office. We would love your feedback on that. If there's any things, I still have a few listed that I haven't talked about, and I may do another show on that. But if you have any different scenarios that you'd like feedback on, definitely email me at info@medicalreceptionistnetwork.com. Feel free to visit our website at medicalreceptionistnetwork.com. The holidays are coming, so we do have our Medical Receptionist Handbook available on Amazon, and you can also order that directly through our website. We have the Medical Receptionist Success Training course also available at our website. We will be continuing to provide new content and do some partnerships into 2019, and we're definitely looking forward to that. So thank you so much for listening to the Medical Receptionist Network podcast. I am Siobhan Atkins. Have a wonderful week.